This is the 8th year meeting of the CardioSteps. I would like to congratulate Amr for his wonderful work. And this year, this meeting is growing up year by year, and it will contain, as we saw, 12 webinars, very interesting ones.
Thank you, Dr. Adel, for this introduction.
Complete revascularization and acute coronary syndrome, is it for everyone? I think it's a very hot subject.
From this clinical trial which apply to the average?
I will try to do my best before I discharge him.
Things pass easily, so you can go ahead and do all the vessels in one setting.
Also, accordingly, if you will do it before discharge or you postpone.
I consider myself a CardioStep part of the family. And I think because of his age, I was a bit reluctant about the G2B3A on top of all of this. So,
and what about the use of 2B3A? I know the patient is an old age. What do you think? I know that you did.
I think those are all brilliant questions, Amr.
Hadi, you are an expert, a senior guy. We appreciate it.
Yeah, Hadi, excellent case. I just want to comment because since we have fellows following our.
Do you take message from this? Did you do an echo for every patient with the STEMI or not?
I totally agree with you, Mohammed. I do the echo for every ST elevation primary PCI patient.
This is a very important trial which really changed our practice and mine.
We should have our own study in the Middle East. I think it's time with Amr that we can start with the.
Nice to see all my friends in Egypt and Jordan and everywhere else.
I'd like to Dr. Mohammed Safri to start this session.
And thanks for organizations.
My discussion is really going to focus around complex bifurcations. Look forward to discussing this complex issue with you all.
Yes, thank you very much. Thank you, Mamas. That was a brilliant presentation. Two very quick questions. The first one, if you have any slides of the new paper you published. The second thing I wanted to ask you was something that's the elephant in the room that nobody ever mentions when we talk about.
You think this is due to the introduction of a technique like ticket rush?
It should be from the start. If this bifurcation is suitable from the beginning for provisional, or I have to do a two-step technique from the beginning.
This is my presentation today about PCI in high bleeding risk patients. Let's go to the Onyx 1 month DAP program, which is the most robust clinical program studying.
What do you think in the future? Is speed quite well can be continuing for 12 months and drop aspirin? Or use drop aspirin, give you B12. Besides, you have a stent for 1 month.
Yeah, thank you very much for your invitation. So I focus my talks left brain and complex PCI. This is the terrification lesion. For example, we have osteal LAD lesion.
What about the size of the balloons you are using? Is it 1-to-1?
But the message that you should do good lesion preparation, assessment of the side branch, choose your technique.
It will be on heart failure and intervention.
I'd like first to congratulate Professor Amr for the elegant annual CardioSteps meeting. And I'd like in my lecture to uncover some of the recent data, how to diagnose the HFpEF and how also to use some of the new algorithms which is recently published in the American Journal of Cardiology.
Okay. Are you applying this algorithm in daily practice in the diagnosis of HPS?
I'm going to concentrate on the nuclear cardiology and how we can use the technique in evaluating patients with heart failure.
Yeah, and I have a lot of information and important information.
It's my pleasure to introduce the chairman of the meeting, and thanks to him for inviting all of us. So Dr. Amr Hadidi will talk to us about the implantation of heart failure treatment, when and which is the right time. Please, Dr.
Thank you, Amr, for this presentation, and I'm very happy to see you all in this virtual meeting, CardioSteps2020. My talk today is implementing heart failure treatment when it's the right time.
Will you shift all your patients from ACE and ARBs to interest to all heart failure patients?
even if no improvement in obviously in the ejection fraction, you see improvement in quality of life. We have with us Dr. Ahmed Wafa, Dr. Taimur Mustafa.
First, I would like to congratulate my dear colleague, Professor Amr Al-Hadidi. My topic this evening is not an easy task.
Yes, many thanks, Dr. Mohammed Abdelghani, for this elegant talk. And it is very essential, as you mentioned, that you keep the patients at the target blood pressure.
First, my talk will be at hypertensive crisis. First, I have to remember this non-staging, normal, elevated, stage 1, stage 2. And again, remember, don't increase blood pressure rapidly, except in aortic dissection.
Very illustrative and informative, all the data regarding the hypertension emergency. I'm very happy that all the attendees are still with us with more than 4 hours now for the first day. My talk today about staging hypertension and management of high-risk hypertension. So no new treatment novelty in the horizon. So you need more awareness and the successfully reduce the secondary stroke except the prendopril. ما فيش ولا واحد فيهم مرة إلا إن البرندوبريل based treatment shows more reduction even the primary and the secondary stroke. I mean the secondary.
خصوصا فعلا هو the best of every class. فعلا combination إن شاء الله يبقى مفيد جدا في حالات الريزيستنت هايبرتنشن.
ألف شكر وبشكركم وإن شاء الله النهارده هنقفل السيشن. النهارده خلص اليوم طبعا الحمد لله اتأخرنا شوية ديلي. إن شاء الله بكرة we'll start at 7 sharp and we'll end at 11. I hope إن إحنا نبقى
إن شاء الله بإذن الله.
أشوفكم بكرة.